We already have people joining. I'm going to give it a couple of minutes before we start the book club itself, if that's okay with everyone. Okay, we have 30 people in the audience, and I think that's more than enough for us to start. So I'm Anne Paul. I'm going to be chairing this evening. I will introduce everyone, but to start with a few housekeeping notes. We are going to be talking about the wonderful book and TV series with Dr. Rachel Clarke. More about her in a minute. I would just like to say to all the participants, and it's quite difficult because I know you're out there, can't see you, but we've had, and you will mostly know, a really busy weekend. Busy for PH, busy for Rachel, for which many thanks. We're acknowledging it, but this is an apolitical space. And I will ask, please, that people are civil to one another, that you respect each other as if you were in a room and talking, because that's what we want to try and achieve. The webinar is being recorded, and I want to say there are topics about which we will talk which may trigger people. Please be aware and know that, keep yourself safe. Okay. We're going to manage the Q&A box, and I'm going to try my best to interrupt. I think it's going to be quite hard interrupting these three people talking, but I'm going to try and interrupt with your questions. If you want to put anything in the chat, please go ahead. But if you want a question answered, put it in the Q&A, please. So I'm Anne Paul. I'm Chief Exec of Doctors in Distress, a charity that looks after the mental health of all healthcare workers. And it is our unbelievable privilege to be the charity of Practitioner Health and of their conference, The Wounded Healer. And I'm sure Helen will tell you more about that later. We'll make sure we put details in the chat box later. I think that's enough from me. Can I please introduce Dr. Helen Garr of Practitioner Health. Helen, say who you are, and then you do the rest of the introductions, please.
Thank you, Anne. Thank you. And before I go on to introduce our fantastic author, Rachel Clarke, and our panelist, Sue Elton, I just want to start by saying welcome to everyone. Thank you so much for joining us tonight in the first of our series of book clubs in collaboration with Doctors in Distress and NHS Practitioner Health. So my name is Helen Garr. May have met some of you before. I'm a GP and I am Medical Director of NHS Practitioner Health. And before we get cracking with this fantastic book club, I really just want to take this opportunity to say the biggest thank you, firstly to Rachel and to every single one of you who's joined us this evening, because I know you have all given us and shown us the hugest amount of support. I just can't tell you how it has felt over the weekend, seeing your support. The people who have been so brave sharing their stories have just blown us away. So I just want to start with just saying the biggest thank you. As Rachel says in her book and says often, the NHS is its people, and Practitioner Health the same is its people. So just wanted to say that massive thank you before we start, before I introduce our two guests. So let's get cracking with our book club. So if any of you have ever been to a book club or know anything about a book club, you know that a book club is as much about the book as it is about the connection and the people there, not to mention the food and the drink. So I hope you've all got a cup of tea or whatever your drink of choice is to settle in. And we want this book club to be about you and your experiences and your thoughts as much as it is about the book. So the chat's open. I can see you're already starting to put things in then. Thank you, Ali, for your lovely comment there. So please do use the chat. If you have any questions for us, stick it in the question and answer box. So I want to start by introducing the wonderful Sue Elton. And Sue Elton is GP, regional lead for NHS Practitioner Health up in Yorkshire. Say hi, Sue.
Hi, everybody.
And then on to our phenomenal guest, Dr. Rachel Clarke. So this is not an ordinary book club. This is a book club. We are so fortunate to have the actual author in the book club. How often can you say that? So we're so lucky. So Rachel is a doctor, as you all know, palliative care specialist, former journalist, and absolute awesome human being. So welcome, Rachel, this evening. Thank you for joining us.
Thank you very much.
So I'm going to start with the book, and as Anne said, and I've been carrying this book around with me for weeks and weeks. It's been sort of my Bible. As Anne said, we know that everybody's COVID experience has been different, but what we are all united in is we all did live COVID together. And this topic, it's a difficult topic, so it might be difficult, some of the things we're talking about, but what we hope is this will be a helpful conversation. So I just wanted to start, Rachel, first of all, and I really enjoyed the book. I thought it was a really important piece of writing, and then the TV series that followed. And I just wanted to start with asking your reflections on when you originally sat down and wrote the book. So you say in the book that actually part of the reason you were writing it was you were finding it difficult to sleep, and your keyboard was your way of processing and getting everything out there. And I just wondered if you just tell us a bit more about your aims in writing the book and your reflections on how it's been received.
Well, absolutely right. To begin with, I was writing down stuff almost to try and, if not get it out of my head, then at least process it a little bit. And I just find writing really helpful as a way of helping me think, reflect. Reflective practice, it can sometimes be a bit of almost a stick to beat doctors and other healthcare professionals with, because we have to submit reflections into our appraisals, our sort of hoops we jump through. But actually, of course, reflection is an incredibly valuable thing to do, all of us, in whatever realm of life we're in. And for me, just bashing away at my keyboard helped a bit. And also, I would have been awake otherwise, keeping my husband awake. So I might as well, sit downstairs and drink a lot of tea and type. And then gradually, as the weeks went by, there were so many points at which what I was experiencing firsthand, sort of as a frontline doctor, was different to the public narrative about the unfolding pandemic. And the most, I think the most shocking example of that for staff early on was PPE, where a huge number of us did not have the right PPE and were potentially exposed to a life-threatening disease as a consequence. And we all started to know colleagues who were infected, some of whom died in our hospitals. And for that to be sort of going on while the public narrative was sort of very different and much more reassuring was really hard. And the turning point for me was sort of early summer 2020, when there was a whole controversy around rule breaking, alleged rule breaking on the part of Dominic Cummings, all in the public domain. And that was the point at which I thought, I've got this block of testimony and I want to get it out there, because it may be only my testimony, it may be just one individual's testimony. I'm not pretending it's something it's not, but it's real, it's what I'm experiencing, and I want to put that out there because I want the public to know that this is what it's like. And that was when I started writing and shaping something for public consumption. And then the television series arose from the same really simple impetus. I want the public to know what this is like, because I don't think they're hearing the full story, and I think it matters. And I think it partly mattered not simply to tell the truth, but more fundamentally, there's that amazing quote by the poet Maya Angelou, there's no greater agony than bearing an untold story inside yourself. I found it agonizing to have my lived experience sometimes denied at a public national level. I felt as though my patients' experiences were being denied, my colleagues were being denied, and that wasn't right. It was a form of harm and deeply distressing, and it needed to get out there therapeutically as much as to inform the public. And the response, particularly to the TV series, was just absolutely phenomenal, with members of staffs saying essentially the same thing. And thank you for getting my story out there, because this is the first time I feel as though my story's been told. My husband, my wife, they understand what I went through for the first time, and that meant an awful lot to me.
Yeah, I think you've absolutely nailed it there, Rachel, because I think what I've heard from people and for myself when I read it, it was validating. And you validated lots of people's experiences. And I know, Sue, you said you talked about this book with your mums in a nursing home, and I don't know if you want to say the response you got from the staff.
Yeah, oh, it was phenomenal. I find it very therapeutic to read your book because it took you from the beginning all the way through to the end, rather than just getting stuck in a difficult loop experience, which I think a lot of people have. I was at my mother's nursing home, and she was having an MDT with a senior district nurse, a social worker, and the nurse from the home. And I mentioned that we were having this book club. Had they read Breathtaking and seen the series? And immediately the senior nurse said, I couldn't be with my brother when he was dying. And the social worker said, I couldn't see my clients. And the nurse from the nursing home said, my colleague died because they didn't have access to PPE. They were in a different organization at the time. And it just immediately, there was just this sort of outpouring of all their experiences and emotions and grief and pain. And we just had a sort of little mini group amongst ourselves, just talking about what it was like to have a mother in a nursing home during COVID, with what was going on politically at the time. And we ended up just sort of all in tears and all hugging, and it was a really sort of transformational moment that was provoked by the book in a group way. And I think it's such a powerful book because it has that ability to transform experience for people in a very human way. And I thank you from the bottom of my heart. It was wonderful to read and share.
Thank you for sharing that, Sue. And I just want to pick up
thank
on
you.
one of the themes actually in the book, and that we've certainly seen in the healthcare staff coming to us at Practitioner Health, and doctors in distress have seen the same, and you've touched on it all the way through your book, Rachel, is this concept of moral injury and moral distress. So healthcare staff being having to make decisions or act or witness things that go against their moral codes and values. And you know, we've seen the TV series staff attending their colleague's funeral by Zoom, and you know, we hear the stories of people having to help their patients say goodbye to their loved ones via iPad, you know, which is so difficult. The lack of PPE, incredibly difficult, and I know I personally found that really difficult. I remember I went on to Amazon and I spent £300 buying masks that just probably weren't fit for purpose, because I felt so desperate in the early days when we didn't have the PPE. And I just wondered what your thoughts are around that, Rachel, the moral stress.
Well, absolutely. I mean, it's very good that the term moral injury is now familiar in healthcare settings as well as the military settings from which it originated. And I think it's something I think about an awful lot in palliative care specifically, because there are certain points in any human being's life that are clearly sort of momentous, life-changing, the things where we are all stretched to our limits in some ways psychologically, I think. And one of those, of course, is the end of life. we're social creatures. Our instinct, and maybe it's an animal instinct, I don't know, but that primal instinct to be there close to the person you love who is in pain, suffering, and maybe even dying is so profound. And I remember this on a personal level when my late father died, when he was very, very unwell. I had this peculiar feeling. I almost wanted to kind of crawl into him. I couldn't get close enough to him. I wanted to hold him so fiercely. I literally couldn't do that because he was too frail. And I think in the pandemic, we all knew, because we're healthcare workers, that that's what loved ones and family members wanted to do, that primal instinct to be there at the bedside, to surround the person you love who is dying with your love, is so momentous. And of course, the necessary barriers, first of all, physical barriers of our PPE, and then the barriers to other people coming into the hospital, were this horrific violation of that incredibly primal instinct to care through physical proximity. So being a part of that, being the person who sometimes had to pick up the phone and say to a son, daughter, spouse, I am so sorry, you cannot come in, and have that individual screaming their grief down the phone at you, was just horrific. And likewise, I think the responsibility, the enormity of trying to provide love and kindness and humanity at the bedside of somebody who could not have the person they loved most of all with them, whether because of the rules or because it was too dangerous for that person to come in because they too were 85 and if they caught COVID they would die. That responsibility was so hard to bear, and I found it hard as a trained palliative care doctor. But sometimes these were medical students, first year foundation doctors, healthcare assistants, junior nurses, maybe a physiotherapist who had now found themselves in an ITU setting and had never been exposed to death and dying in that way. So all of us were thrown into radically wrong circumstances, as wrong as they could be, as sort of primally grotesque almost as anything certainly I'd encountered in my professional lifetime. And we had to step up and do the best we could, with really only the support of each other. But I know probably most of the people in this discussion probably felt unable to ask support from their colleagues, because if they were anything like me, they would think, I can't say to someone I'm finding it hard because they're going to be finding it hard too. So we were all doing our best in these really difficult circumstances, in desperate need of support. And I think that's a defining feature of the pandemic. And actually, to some extent, tragically, it is still a defining feature of NHS care, which is desperately under-resourced. So many staff are trying to do too much with too little and feeling as though they are failing because the system is causing them to fail. And it's just an ongoing, immensely difficult challenge.
Rachel, can I just hop in for a second? Because of the four of us on the screen, I'm the only non-medic, and I just want to comment that on moral injury, reading your book, which by the way I listened to on Audible, so you told me the book twice and it was very powerful, but listening to you describing how you felt, how it felt to you, for you and all the colleagues, was a reminder for me that the book and the show has enabled the public to understand better what moral injury is, and to understand that it's not going away. It was something that started with the pandemic, but is an ongoing thing. And I think it's a message that we need the non-medical, the public in the UK to know about as well. And while I have you, I wanted to just read you a couple of comments. Karen Alsop, you put your name on there, so I'm hoping it's okay for me to read this. She said the TV series has told the previously untold story for the public. For me, it's relieved a huge burden. For the first time, I feel I can move on and look to the future. Thank you. And one other, I'll keep this anonymous. I was reprimanded by my manager for taking the precautionary measure of advising my colleagues to put on available surgical masks on the first day of lockdown. I now wonder how to respond to top-down advice when my clinical judgment and training questions those in authority. With the duty of candor, I speak up. I leave that with you.
Lucy's commented moral injury is an isolating burden. We see this, don't we, Sue, in the healthcare staff who seek our support. Lucy said the book and the TV series have provided an opportunity for individuals to step out of the isolation and share that burden with others and see that they're not alone. And I hope that if nothing else, this session this evening allows everybody and the people watching it down the line to see that they are not alone. And I wanted to pick up on that because actually you said, Rachel, we all felt you couldn't burden your husband. We all felt we couldn't tell our families, we didn't want to upset them. We felt we couldn't talk to our colleagues because everybody's just trying to keep going and keep their head above water. And what you have done is given a voice to the experiences that everybody went through. And I think that's such an important voice, not just for healthcare staff to know that they were not alone, but for the general public to understand what we were going through. But what I was really taken by in your book, you commented about training the medical students. And you said that we are, and I totally agreed with you, it really resonated, that we are taught in the unwritten curriculum at medical school that to show emotion is weakness. And we are taught, I think, as well in the culture of medicine that to be unwell is seen as weak, which is why Practitioner Health exists, to allow people to come and get confidential support. But what you said was you taught, and I thought this was so powerful, you taught permission to feel.
Yeah.
And I thought that was so powerful. Do you think, Rachel, that we have got better as a result of our experiences in the pandemic as healthcare staff at feeling and speaking up and expressing and permission to be off sick if we're poorly? Have we learned permission to feel, do you think?
I think to some extent, yes. And always these, if you look back through history, these moments of enormous upheaval in society, and clearly the pandemic has been an immense upheaval, they're often opportunities for change and innovation and disruption. And from the Second World War, we got penicillin and we got women doing men's jobs in a radical way, for example. And I think likewise, I always believed through the time, and sometimes I would say to myself at my low ebbs, good things are going to come from this. I believe good things will come from this. And I think one of those good things is a greater willingness on the part of staff to be open about the fact that they're struggling, and actually for employers to pay more than lip service to the fact that they have a job to do to keep their staff healthy and therefore able to care for others. And we did see an incredible outpouring of services, both locally and nationally, for staff. Now, there's a whole other question about those being cut, which is not the topic of tonight's discussion, but I think that's a really positive thing. We know that paying lip service to the idea of mental health and genuine staff well-being, there's nothing that gets staff angrier more quickly when you get an email about a Zumba class that you can't go to because you're on a 13-hour shift and you can't give anyone your bleep. That probably has a tendency to burst a blood vessel more than anything else. But actually in the pandemic, it wasn't lip service. My hospital, I think many people's places of work were really trying, and that's definitely a positive, and has sort of normalized the fact that the responsibility of caring for people who are suffering and whose stories sometimes strike such a chord with you as a human being that the very instincts that drove you into healthcare now are causing you distress because of the burden of suffering this person in front of you. That's a really good thing. But I think probably in all of the medical professions, perhaps particularly in medicine more than any other, the sort of stiff upper lip, you have to be in control, you've got this, don't show emotion, don't show weakness, is still very, very prevalent from almost day one of medical school onwards. And that's not a good thing. I think the challenge is to talk openly about a specific thing with staff and with students. And the specific thing is the challenge of maintaining sufficient objectivity to do your job properly, while not being so detached that you either become burned out yourself or you lose all of your empathy. Navigating that tightrope between detachment in order to do a job versus maintaining your empathy and soul, for want of a better word, I think is one of the greatest challenges for any healthcare professional and one of the least discussed. And if I were designing medical school curricula, on day one, that would be the first lecture. People do not talk about this, which is strange because it's even harder to learn than the Krebs cycle, which for people who don't know is a horrifically complicated biochemical mess, for want of a better word. I never understood it properly.
We've all forgotten.
Indeed. So that, if there was one thing that could come out of the pandemic, it would be not just let's give people permission to feel, but can we please talk about the fact that this particular challenge is one of the hardest things you're going to do in your career as a healthcare professional. Let's talk about that, because if we don't talk about it, the danger is the message we are sending junior doctors, medical students, etc., is that somehow everyone else does it easily and you've got a problem because you don't. It's the hardest thing you do in medicine.
Rachel, I'm going to interrupt again because I have a couple of questions that you have sort of answered, but I'll go for the one on my screen at the moment. What one or two key messages would you want readers or listeners to take away from having read the book? And what would you want healthcare workers to change in their behaviors and practices as a result of reading this? And the other question was around the stigma and the fact that I think Rebecca Miser, your question has been answered by the wonderful things that Rachel has been saying. But have a think, and what do you all think about the key messages that you want people to take away?
Well, I mean, my answer to that question is very simple. It's if you find yourself struggling, if you find yourself crying at the end of a difficult day, or actually crying when you're at work because it's really tough, please try and take a moment to, before you start beating yourself up and saying it's because I'm rubbish, I'm a failure, I can't do this, I'm not capable of being a doctor, a nurse, whatever. Try to take a moment and say, this is horrible, I'm feeling horrible, but why am I feeling like this? It's easy to assume it's my failings, but could it in fact be something else? Just ask that question. Could it in fact be something else? Could it be the fact that I work in A&E and I am in a corridor trying to work out which of the 6 desperately sick patients in front of me get the only bed in resus? So I'm trying to work out which one of these guys is most likely to die. And if I get it wrong, the other ones might die. Could it be that that amount of stress and the sheer grotesqueness of treating patients in a corridor full stop is the thing that's making me feel like this? In other words, could the locus of my distress be external to me and be about the conditions I'm working in rather than a failing. I'm the kind of person who always assumes it's me. I've been like that my whole life. Take a moment and think, maybe I'm not uniquely weak. Maybe what I'm being asked to do is impossibly demanding, even if I had superhuman strength and 30 years experience, because it's not right. No one should do this. And try to just take a breath and ask yourself that question and talk to someone you trust about it. Probably a colleague. I find talking to colleagues really helpful. A friend, a family member, someone you trust who's a senior. In my experience, not always, but most seniors, if I've ever confided weakness, failure in inverted commas, to a senior doctor, I've been astonished by how they've reacted. I've seen them as more human than I've ever seen them at any other point. You're never alone, even if you feel like you're in a difficult, dysfunctional team, you're being bullied, you're being isolated, you are never alone. There are people who care about you and who want to help you and respect you and know that the core problem here is not you, even if you believe unshakably that it's you. It is the circumstances, the situation, and they want to help you. And have faith in reaching out to someone. That's my simple message to people.
Sue, do you and Helen want to add anything? Because I've
I'd
got other
love to add
questions.
that Claire Gerarda said something once that really resonated with me, which was the reasons we become doctors are not solved by being a doctor. And everybody has their story as to what inspired them to go into medicine. And that's not solved by doing it often. So we're very, very lucky to have Practitioner Health. If people do notice they're struggling, then do just come and see us. I'm sure a lot of our audience already have, but it's very important to seek help, and I'm so pleased that the conversation is wider. There's more understanding of workplace culture and the impact that has. The good medical practice is changing. The duty of candor is changing. Things may change slowly, but they do change. And with everybody together working for our patients and acknowledging that we ourselves are human beings and we're all linked by humanity and the human condition, things can only become more and more healthy. And I do think the book Breathtaking has been a real fulcrum for the conversation and helping us in a, as I said earlier, transformational way. So keep talking. I agree.
Yeah, and I would echo that. One of the big themes that ran through that book was these flashes of humanity and kindness in a really harrowing time. And my message would be to everyone out there is that you are cared about and you matter. And often it feels sometimes in a system that you're not cared about and you're not valued, but you matter. And there are people who care about you, your colleagues. Practitioner Health, we care. That's our fundamental value. We care for you so you can care for others. Doctors in distress are also there. You need to mention that. But you matter, but also care about each other. Humans are fundamentally kind. Humans are fundamentally good. And often, as Rachel said, we don't reach out to each other because we're so busy trying to keep our own heads above water, or we don't want to burden other people. But we know that when we change to not just, we say reach out, don't we? Reach out, ask for help. How hard is that to put your hand up and say, I'm struggling? That's incredibly hard. But I think it was Neil Greenberg who said once, I heard it, let's change our culture so we reach in. We reach into each other. We check in on each other. It's so powerful to ask somebody, how are you? And really care about the answer. And ask twice, because as Neil Greenberg really famously says, if you ask, how are you, what do you get back? I'm fine. Ask twice, how are you feeling? You know, I've noticed you've been a bit quiet. I've noticed you've not been quite yourself. I noticed you've been coming in a bit earlier, staying a bit later. How are you? We know that when people have a little nudge from their colleagues to check in on them, they're more likely to seek help. So my message would be, you matter and you are cared about, and we are here to support.
And all those equivalents that people have, you know, I value because I'm at work. I'm valued because I do well at work. I'm valued because, you know, and actually, these things get set up and aren't necessarily helpful. So, you know, you're valued because you're physically present, not because of your exam results.
Yeah, and I'll just say one more line. I say this a lot, is that we all think we're irreplaceable at work, and we drag ourselves into work when, looking back, there's times think, what on earth was I doing? Why was I there? And we all believe that we are, but categorically we are all replaceable in our jobs, but we're not replaceable as wives, mothers, sons, fathers, friends. So it's so important we remember that, and we're able to look after ourselves, and put ourselves as well as our patients first. But I just wanted to pick up on, I don't know if you noticed some wonderful comments in the chat, and somebody has commented about kindness and sharing the humanity during the pandemic. And this big movement now, the civility saves lives, and Turner, anyone watched, incredibly powerful book. And of course, we know that when we are incivil to each other, patients die, you know, wounds heal faster when staff are kinder to each other. And I just wondered what your take on that is, Rachel. Did we learn from those flashes of kindness and humanity that we saw in COVID, and how do we keep that momentum going?
I think one of the problems with kindness is it's a word that is very misused. Hashtag be kind is as infuriating as a Zumba class that you can't go to when it is proposed by, you know, senior management that you feel very detached from, that you know have not, either because they don't know about it or they're unwilling, they haven't changed conditions of your work that are really, really difficult and unkind for you to endure, such as, you know, and something as trivial as you have to pay £20 a day for parking because you can never get into the staff car park. That is not kind. That is a brilliant way to alienate a member of your workforce. Or, you know, the unkindness of being subjected to working conditions of perennially unfilled rota gaps, so you are always on call doing the job of two doctors. If you get an email from the same hospital management that doesn't care about you doing that day in, day out when you're on call, and they have the temerity to urge you to be kind or say incivility costs lives, that's going to make you very angry. The truth, though, I think, is kindness in the real sense, so not paying lip service to kindness, but actual kindness is a superpower. Think about the times in your lives when someone has shown you a tiny act of kindness. Think about how it has transformed you. So one example for me is early on in my days in palliative medicine, and palliative care teams tend to be kind in the true sense because we know we need to support each other. There's no shame about that. I had to sit down with two young children and answer all their questions about the fact that their mum was going to die. And I knew she was going to die in the next 48 hours, probably. And it was very, very hard. And I made myself like steel inside. I crushed every feeling I had in order to do the vitally important job of communicating well with those kids, because I knew I could cry on the way home. And when I went back to the doctor's office, no one was there. The other doctors had politely vanished. And at my computer, there was a little plate with some biscuits and a cup of tea. Nothing else, just some biscuits and tea. And I walked in and I did burst into tears because that was my team saying, we know you've just had a really, really tough time. Have a biscuit. Have a crappy NHS biscuit that we've stolen from the NHS supplies. And it meant so much to me. I've never forgotten it. And then, of course, I found the person who did that and I cried with her and said, yeah, it was really hard. It's the hardest conversation I've ever had with anyone in my entire life. And I cried for a bit and then I cracked on with my job because someone had been kind to me and I have never forgotten it. Those simple, sincere acts of kindness, and it could be as small as someone reaching out to you and squeezing your hand, and that hand squeeze is a way of communicating, I know you've just done something really hard. I know you're really suffering. You're not alone. I'm here. That's a superpower. And we can all do that every single day at work. There is never, ever a day in the NHS when you can't make someone's life a little bit better. Because if you are that person who squeezes the hand or simply gives your patient the radical act of kindness of paying attention to them and listening to them and really listening to them when they say, I'm scared, I feel awful, you have done something that they may never forget. You were the one doctor, the one nurse who listened to them. So we all have that superpower, but it's the hardest thing to remember when you're burned out, overwhelmed, exhausted at work. But I try and do something, some tiny kind thing every single day, because I know that I can come away from work at the end of the day and say, that was really tough, but I connected with that patient. I helped this patient. Once I brought, sometimes I will bring an ice cream or a can of Coke to a patient because they just don't want to keep getting NHS squash. They like Coke and no one else is going to bring them a can of Coke. So I'll spend £1 in the canteen and give them a can of Coke. That can be transformational. So I think kindness to patients can be really replenishing to us as caregivers. And of course, crucially, kindness to each other is absolutely vital. And you may be the only person who ever really asks that member of staff how they feel that day. How do you really feel? You may be the only person who gives positive feedback to the junior doctor who looks like they're going to collapse on their feet because they're so tired. And you say, thank you, you did a really, really good job with this patient because you were worried they weren't getting the right treatment and you phoned us. I just want you to know that makes you a really good doctor. That takes 10 seconds and that doctor might take that away with them at the end of the day and feel like they're valuable, they're good, they've done something good. So kindness, giving kindness is a way of replenishing ourselves. And it's also a way of helping our desperately hard-pressed colleagues get through another tough day at work. So it's a superpower. So here's to real kindness, less of the lip service kind.
I love that, Rachel. And actually, I end every day. And like many people, sometimes I think, oh, I haven't done a very good job today. And if I have a day where I feel like that, I particularly challenge myself to think, where did I make a difference today? And it might simply have been I sent a kind email or it was nice to somebody who phoned me up when I actually wanted to snap. But how did I make a difference to somebody in some small way? And it's a really useful thing to do to make yourself realise that what you do is valuable. Sue, were you about to come in?
Sorry, can I just say Ros Tritt, I think, has just said, to paraphrase Maya Angelou, it's not what you said or did, it's how you made me feel.
100%. I've
I
seen
didn't
that.
want to lose that moment to put that in. Thanks, Ros.
I've seen that flying around all over the weekend on social media, and it's just as Rachel just said, if what people are saying is not connecting with what they are doing. So if you go to work and you've got nowhere to hang your coat, or you can't park your car, or you get a parking ticket every time you go to work, or you're not even allowed to have a cup of tea in the workplace for free without fear of getting into trouble, and then you're getting emails telling you to be kind, there's a real disconnect there, isn't there, between how people make you feel. Sue, you wanted to come in?
Yes, I was going to say, in your book, Rachel, you talked in the pandemic how people really miss that physical connection and that touching and that being together as human beings. And I think since the pandemic, where so much has sort of gone virtual, and there's almost a reluctance to be physically close in the same way. And I wondered, in terms of just that, just feeling safe to be that close, because there's so much within us that still is unresolved potentially, and still being processed and still ongoing, you know, that sort of hesitancy to be close in the way they were before. If you had any thoughts on that.
Well, I know that for many people, one of the things they get most angry about, and very understandably, is any sense that someone is saying the pandemic is over, it's history. It's not over. The WHO is clear that the pandemic is ongoing, and if you are clinically extremely vulnerable, for example, then that means potentially every social encounter is very, very frightening, particularly one where you may be in hospital or a healthcare setting. And I know that many people understandably feel as an incredible unkindness and callousness the fact that we're not all still wearing masks in hospital, that we are not making sure that proper ventilation is absolutely top of the agenda in every healthcare setting, schools, every other setting. And I really empathize with that. And I know that it creates great fear, because even if a much smaller number of people are dying of COVID now, mercifully, that's the case with vaccines, it is still the case that people are dying of COVID, and that people are being left disabled by long COVID. So I think that's really difficult. It creates a very understandable cause of distress and fear amongst some people. And of course, there are staff, healthcare staff, who are clinically vulnerable. And more widely, we are still, I think, as a society, adjusting to the fact that we were separated. We are creatures who live together in communities, but we were radically and suddenly separated physically from each other. And that, I think, is a disturbing and shocking thing. It almost seems unimaginable now sometimes when you think back to when that first happened 4 years ago. And I think we're wrestling with that still. Increasingly, it's the case now that we use online forms of communication, such as this book club tonight, instead of, rather than as well as, face-to-face communication. And of course, that's really wonderful in some ways. It's empowering, it's inclusive, it means people can join from all parts of the country, the world sometimes. But it also means that we are less familiar with and used to everyday close contact, social closeness, not social distance. And I worry about that, because I know that I am a mammal as well as a human being. I like to be near my warm-blooded fellow mammals. I like the touch of them. I like the view of them in front of me. I like to hear them. I like everything close up, because I'm a mammal and I like to be near people. Now, not everyone is the same, but for me, that's that's just a very important part of my well-being, being close to people. I find being alone for long periods difficult. I'm happier if I'm close to people. I loved the fact that throughout the pandemic, I got to work with my team. I got to see everybody in the hospital. It was a source of enormous nourishment So I think we've all been through something so alien and disrupting, and now we're still, social interactions have lost their innocence, haven't they? They are all potentially now the death of us, even though we have vaccines, and even though, the mortality of COVID is much, much lower than it was. Nothing is quite as easy and straightforward as it was. And I hope very much that those feelings will gradually fade, but I'm not sure they fade if we just pretend that that's history and we've moved on and the pandemic's over and everything's back to normal, because it isn't. We need to be talking about this. And I suppose, again, that was one of the reasons for particularly making the television series. Should we not be having a conversation about the fact that the country has just been through the biggest upheaval any of us have experienced since the Second World War? Probably that's a good idea, rather than pretending it's something that can be brushed under the carpet.
100%, Rachel, and that was going to be one of my final questions to you, actually, is we're not out of this yet. That the effects are still being seen. We're seeing the effects in communities. We're seeing the effects in the healthcare staff who come for support at Practitioner Health. That the trauma that people have experienced is, in some cases, only now starting to make itself known. So how do we, as humanity, as society, how do we move forward? How do we heal from this? And you've already started to touch on that. I think we talk about this. We don't pretend this just didn't happen and move on. We start having these conversations, incredibly difficult as they are, actually. And some of the stories people have been sharing in the chat tonight, people have had some really difficult experiences. And actually, I think often, sometimes in healthcare, things we accept as normal or just shrug off and accept part of the job really are not normal and are traumatic. But so back to my original question, Rachel, how can we start to move forward from what we've experienced and start to heal from what we've all experienced?
Well, I think the first thing that maybe is helpful, I certainly find is helpful, is to try to remember that we're not alone. I think we are all connected by something very radical. For the first time in our lives, we have all been through the same collective traumatic experience. We've all had our own individual versions of that, but everybody has lost something. Everybody. We all lost our complacency. We were all suddenly thrown into a world where the very air around you could be something that killed you. Your proximity to another human being could be the thing that kills you, or kills your mum or your son. Your children going to school could be the thing that kills you, that brings back a virus into your home, that could kill your clinically vulnerable husband. Worst case scenario, we've lost someone we love, or we lost our own lives. There are all the people, the 230,000+ people who died of COVID. So we have all been through loss and trauma collectively. And I think it's really important to remember that unites us, and also remember what things were like at the start of the pandemic. It's easy now to see the whole thing as bleak and black and horrific, and clearly it was in many ways. But think back to those first weeks when overwhelmingly people's instincts in the face of this crisis were to help, were to step up and do what they could for other people. I know that wasn't entirely the case. There were certain people who tried to make many, many millions from PPE, but that's an entirely different topic of discussion. And this is an apolitical book group. So I will name no names. But think of all those WhatsApp groups in people's streets where people set up groups to do the deliveries of medicines for the vulnerable people who were shielding and couldn't get food or go to the supermarket. Think about the fact that over 1 million people volunteered to help the NHS, to work in the NHS in 48 hours. think about the mountains of pizzas that people used to send to hospitals because they were so grateful to the NHS staff who were risking their lives. All of those instincts, that almost makes me want to cry now thinking about that. That was our society. That was us collectively being good and decent and strong and saying to ourselves, my God, this is a crisis. Let me do what I can to help. Yes, it all got more fractious and more, disruptive and difficult and full of conflict as things wore on. But those instincts are real, and that's us. People are decent. When push comes to shove, what I saw during the pandemic, more than anything, every single day at work, was people being astonishingly good, decent, courageous, compassionate, brave in really bloody difficult circumstances, staff, family members, and patients alike. And I cherish that. And that's the building block for the future. You know, I don't know how we go from that to everybody recovering. That's 1,000 steps. But let's make that our starting point. Let's remember what we showed each other at the start of the pandemic, because what we showed each other was decent and something to be proud of.
And I'd like to just say, in terms of your book, you use such wonderful language. You use adjectives and adverbs and all those good things that as doctors we just write in notes, you know, broken arm, you know, that there's that humanity in the language in your book. The phrases like nothing curdles the soul really stuck with me, you know, and fear spreading like a virus, you know, just to actually use those words and you can relate to them. So I think talking to each other, as you say, and using actual human language and not being stuck in medic speak. So I thank you for your book, because it just links the human being with the experience, with the history, with the times, with, you know, generations. It's phenomenal. I really thank you, Rachel.
So I'd like to come in with
Thank
that,
you.
because I absolutely agree with what Sue is saying. The content is obviously really important, and it's come across in both book and TV series. But the way you write your books is personal. You're talking to somebody. It's beautifully erudite, but not highbrow. I really love the way you write, and I think that might be because you're a journalist as well. But someone put in the Q&A, and I said it was a cheeky question, but I'm going to ask you anyway. What's the title of your next book? Are you writing another book?
Well, well, this is a very exciting announcement. I have written another book, and the title is The Story of a Heart. And it is an incredible story about the two children who are called Max and Kira, who are the children behind Max and Kira's law, the new law around organ donation that has changed the law in the UK to one of presumed consent. And Max is a little boy who spent nearly a year in hospital needing a heart transplant, on the brink of death for that time, 9 years old. And there's an incredible shortage in children's organs, especially adult as well. And Kira is the name of the little girl who died and whose heart saved Max's life. And I have the book, the central character of the book is Kira's heart. And I have written the story of Kira's heart from the day before the car crash in which she was left brain dead, to its life inside Max, the little boy she saved. And it's a story of the NHS at its absolute most magnificent. So I've interviewed the surgeons, the nurses, the paramedics, both families, and it's an extraordinary story of the most radical kindness in the most dark circumstances, a family deciding to gift their daughter's organs, a little girl's organs, to save the lives of 4 people, as she went on to do. So that is the story of my next book, and it's coming out in September.
And I've got to ask you for a promise in front of everyone that sometime after that you'll come back and do another book club with us and talk about that. Helen, I think
Thank you.
we are at time, so
I am going to bring us to a close. I think that's the perfect ending. I'm so excited that we got the scoop on Rachel's new book, and I can't read it. And well done for pinning Rachel down to the next book club. So I just want to thank everybody for joining us, everybody for taking part in our book club today. I want to thank Sue and Anne for coming and giving their wonderful insights. Rachel for just being the most phenomenal power for change and wonderful person. I could listen to you for hours and hours, Rachel. It's just beautiful the way you speak and write. And thank you for sharing your insights. And most importantly, thank you to everybody who joined us, and thank you for everything that you do. And if any of the issues that we spoke about tonight have affected you, please do see our Practitioner Health website and Doctors in Distress for where you can get
the
support.
information is on.
And thank you.
Sorry?
Sorry, I was just going to say thank you so much for organising this. What a brilliant thing to do. I'm looking forward to joining in the audience of the next ones.
Awesome. And the next one is on the
Great thing to do.
4th of June with Benji Waterhouse. So it's a comedy book, so slightly different topic, but this has been just fantastic. Thank you, Rachel.
Thank you from all of us.
And I'm just going to I'm plugging Benji's book. I've read an early copy. It's a comedy book that is deadly serious about wounded healing. It's brilliant. So really, really recommend everyone comes to it.
So the same time in the evening on the 4th of June for that one, everyone. Look out for the links. And thank you all. And thank you to Tia, who's been in the background making sure that the tech works.
Thank you, Tia. Thank you, everyone. Have a lovely
nice evening. Take care.
Bye.
Bye-bye. Thank you.